is a platform extending helping hand for medical students in exploring at various career options and ways to achieve them. This video is successor of part 2, so please have a look at previous parts given haven't done so. Alright. See, it was like say FY2, ST1 and ST2, it is like compile everything and it is like MD medicine. But there, like it is FY1 and FY2, like internship and a year after that is separate. Then core medical training or like core surgical training for that sort for those people who want to go for pursue for surgery. It is you have to apply go for exam like MSRA exam, and then after that see one in chat one of the questions were like after doing PG can we get into UK pathway. Yeah, obviously we can go for a UK pathway, but it will be like a bit more tough because you have to present like you have to have a certain number of research papers and there will be certain criteria for it, and which will be like upgraded criteria as compared to a fresh MBBS graduate to get into UK pathway. And for that we have to write like MRCS or MRCP, like it is membership of Royal College of Physician or membership of Royal College of Surgeon examinations, and then you'll be able to get it into specialty training. And this specialty training is like our equivalent to like MCH or DM, like 3 year here in India it is like just 3 year course, but there it is like 4 or 3 years course depending upon the stream it is. See, and see another thing which confuses us a lot is look at this thing core training, like we compared this thing with this MD medicine, this thing, and there is one more thing is run through training. See this I'll be able to make another analogy so that we'll be able to understand a better way. See at this NIMHANS there are certain courses like you get into it right after MBBS and get out and you just exit after becoming a MCH, after taking a MCH neurosurgery. So just consider it is in a similar manner. The run through courses are just like those courses of NIMHANS. It is like you get into it right after your MB, right after your FY2, and you exit after becoming a consultant after passing this FRCS examination. Whereas this core specialty training, it is as mentioned earlier, it is like split part. You do this MD or for that matter you do MS, and then again you do MCH, and this MCH there it is like higher specialty training. It starts with ST3 to ST7, and this core specialty training is like CT1, 2, or in certain specialty it is like 3 years of core training is there. So the basic rule again I'll repeat it so that it is ingrained into our brains. Okay, you do your MBBS, I mean we have to do our MBBS, then 1 year of internship here in India. Then after that we have to get our CREST form signed, and that CREST form means that is just a form which testifies we are having a certain set of clinical skills, and that any during our 1 year of our job any consultant will be far more than happy to sign it for us. Then after we can go either into run through programs like just like our NIMHANS programs straight all the way like 7 to 8 years, and you become a consultant. That is the exit point. Otherwise you are having the other pathway, that is this is the more common pathway, and that is like you get into a core specialty training. You can equate it with like MD medicine, and then after that, and this core specialty training here the catch is it is in most of the cases it is just of 2 years. But suppose if taking example of surgery in medicine in UK it is of about 3 years of core specialty training, whereas surgery is of only 2 years. But higher specialty training of medicine is only of about 5 years. But when we are talking higher specialty training of surgery, it is about 6 years. So if you are going for medicine route, it is like 3 plus 5, and if you are going for surgery route, it is like about 2 plus 6. So like it almost it becomes like 7 to 8 years at last. this is the basic pathway, and everybody must have this thing clear in their head. Otherwise, every other time when you look this UK pathway, you'll be having a difficulty. So please, everybody, pay attention to this chart. So this is where we are. Can you see my cursor moving? This, look at this point, this graduation from university. So if we have graduated from university, this is like we have done our 4.5 years. Do not count our internship year into this. We have done 4.5 years in this graduation from university. Then comes this foundation years. Consider this FY1 as our internship year. Look at this, please. This first eligible attempt for MRCP or MRCP UK Part 1. So after this FY2 year, this is where most of the international medical graduates get into. So you can also get into FY1 year, but it is a bit difficult. So this is the most common pathway, FY2. So once we get into this, then there are two things. See, this core medical training. This is this whole pathway is for to become to get into a PG degree of medicine, but it is like almost similar for most of the specialties except a few. We'll be dealing with this exceptions later on. Then this core medical training, you get into this core medical training through that PG exam of UK, that is MSRA, multi-specialty recruitment assessment. This 2 years. Then you get into this specialty training. See, in our setting in India, it is like once you have done internship, like once you have done FY1, then you directly get into like 3 years of MD medicine. But here it is like after you have completed 1 year of internship, then you have to do another year of FY1, and then you will be getting into core medical training.
Like a bird on a tree, I'm just sitting here. I got time, it's clear to see.